Good morning and thank you for joining us. Teresa is not here today. I'll report our local numbers. We now have a total of 10,494 cases, an increase of 216 cases from yesterday. 31 of these cases are related to outbreak, 10 are close contacts of a confirmed case, 6 are non-epi-linked, and 169 cases are still being investigated. 2,802 cases are still active. 7,451 cases have resolved. We now have a total of 241 deaths, an increase of 4 deaths from yesterday. A man in his 70s, a man and a woman in their 80s, and a woman in her 90s passed away. My deepest sympathy for the families who lost their loved ones. At present, we have 111 cases that are currently hospitalized. 18 of them are in ICU, and 196 suspect cases of COVID-19 is in our hospital system. There are currently 46 active outbreaks, 20 long-term care home, 21 workplaces, 2 hospital outbreaks, 1 community outbreak. Windsor-Essex County Health Unit, in partnership with the Windsor Regional Hospital, continue to vaccinate the area residents based on the provincial priorities. We are on track to finish the initial round of vaccination at the retirement homes early next week. Last night at 12:01, the province implemented a stay-at-home order for the residents of Ontario. Under the order, every individual shall remain in their place of residence at all time unless leaving their place of residence is necessary. Some of the examples that are identified include work, school, and childcare reason, obtaining goods and services, and elaborating further on obtaining food, beverages, and personal care items, obtaining goods or services that are necessary for the health or safety of an individual, including healthcare services and medications, obtaining goods, obtaining services, or performing such duties that are necessary for the safe operation, maintenance, and sanitation of household, businesses, means of transportation, or other places. It also includes purchasing or picking up goods through an alternate method of sale, such as curbside pickup from a business or a place that is permitted to provide curbside pickup under the Stage 1 order. Attending an appointment at a business or a place that is permitted to be opened by appointment under the Stage 1 order. Obtaining services from financial institution or check cashing services. Obtaining government services, social services and support, mental health services support, or addiction services support. You can also leave for assisting others who need it for various reasons, such as healthcare reasons or other reasons as necessary. Health and safety and legal purposes, which includes doing anything that is necessarily to respond to or to avoid an imminent risk to the health and safety of an individual, which includes protecting oneself or others from domestic violence, leaving or assisting someone in leaving unsafe living conditions, and seeking emergency assistance. You can also leave your home for exercise, including walking or moving around outdoors, using an assisted mobility device, or using an outdoor recreational amenity that is permitted to be open under the Stage 1 order. If you have multiple residences or if you're moving, you can also leave your home. You can only gather for the purpose of wedding, funeral, or religious service, rite, or ceremony that is permitted under the Stage 1 order, or making necessary arrangement for the purpose of such gathering. If the individual lives alone, gathering with the members of a single household is permitted. If you have animals and if you need to get them active, you can do that as well. This order does not apply to individuals who are homeless, and as many other details are coming out, we'll continue to share and continue to post that information on our website. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Hi, good morning. Yesterday, Dr. Ahmed, you mentioned that you wanted to see what was in the new legislation before weighing in on whether you think it would be effective in stemming the tide of COVID-19 infections. Just wondering what your thoughts are.
Well, I think the message is loud and clear from the province that they want people to stay home and to maximize the work that can be conducted from home. There are still some interpretation that is left to the employers in terms of who are essential and they must come to work depending on their unique business needs. There's no one formula that can solve all of that. So we'll have to wait and see how it eventually plays out in terms of the mobility, in terms of the people's desire to work from home versus the businesses need to have them at work. There are a number of proactive work that's been done by the province as well to monitor these businesses that continue to stay open and to make sure that they're in compliance with the order. So I think it would be too early to say that how it would look. There are still some level of interpretation that is left to the businesses and also to individuals. So we'll have to assess the situation before we can say further. Our area continues to be in gray lockdown zone, so there's not a lot of changes in our areas other than ensuring that the businesses and everything that are currently operating to forcefully look for ways to allow people to work from home. And also, most importantly, is to make sure that there is no ambiguity, there is no doubt in anyone's mind that if they are out and about, they can be asked, they can be questioned, they can be stopped to provide some explanation or some answers to the various level of law enforcement that are empowered to enforce that order.
And with regards to the completion of vaccinations within retirement homes, are you able to say which group is on the list next for vaccinations?
So as we speak, in partnership with working with Windsor Regional Hospital, so right now, public health is working directly with these homes because these homes need these vaccine on site. So public health is working closely directly with these homes to administer, deliver, and support these homes in getting the vaccines to primarily their residents, their essential caregivers, and the staff that are available and who have consented to get the vaccine on time. From the Windsor Regional Hospital perspective, some of the leftover residents, some of the leftover workers, the essential caregivers, if they are unable to get the vaccine with the initial round, they are going to the St. Clair College clinic to get their vaccine. And in addition, the Windsor Regional Hospital is also rolling out the vaccine in the healthcare worker category. There is, as I explained yesterday, in terms of the provincial rollout, there is a prioritization committee that is taking its shape in terms of sub-prioritizing each of these groups to go ahead with the vaccination. Once these two populations are addressed, the next that would be on schedule from the province is to work on the remaining individuals or the remaining priorities of phase 1, which includes the adults receiving chronic home care, as well as essential workers that also participate in some of the emergency medical response, as well as the adults living in the Indigenous communities in remote locations.
Thank you.
Any questions from Blackburn?
No, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. I know throughout the pandemic you've had a lot of things on your plate at once, but right now, what are you most focused on accomplishing for the region?
So right now, my biggest concern is the ongoing cases that we continue to see, especially in with some of the outbreaks, and then ensuring that we are also actively rolling out the vaccine in the best possible manner, and to make sure that the vaccines are going to the right people. So that's the key priority at this time for me and for my team, recognizing that the next few months, in fact, 7-8 months would be really crucial for the vaccine rollout. And also, when we start to vaccinate more and more people, we expect to see that the burden of illness will decline, because that's where, when we are seeing the long-term care home and retirement home, that's where most of the unfortunate deaths are happening. And if we get them in time to make sure that we are preventing some of these deaths, that would be an accomplishment. We are already there, at least with our first round for all the residents, and then we'll be obviously looking to go for their second round of vaccine to get them fully protected. And then ensuring that with some of these restrictions in place, we should see a decline in the number of cases. That would give us a little bit of breathing room to focus more on the vaccine front, and we'll engage everyone to make sure that we are able to vaccinate as quickly as possible, depending on the supply that we are receiving from the province.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, if the stay-at-home order doesn't work and the numbers keep on going up, what else can the province do? What can we do here locally? Would it have to be a full-out lockdown next?
Well, I think even the provincial order for these measures, these are beyond public health measures. So I would expect that if these doesn't work, then the province really need to look carefully at how they can plug some of these holes where there are still some ambiguity, and if people are not adhering to it, what other options we have. I think it's important that we need public support. Doesn't matter what kind of legislation, doesn't matter what kind of order that's put in place, we need public support. And as much as I said, majority of the people are following some of those recommendations, but we are also seeing that there are still businesses, there are still opportunities that are out there, which can be work remotely, or people don't need to leave their home or to be outside or to be with other people. So we really have to be creative and looking for opportunities to reduce the number of times that we are leaving our home and coming in contact with other people.
Yesterday, Tecumseh held budget deliberations, and they made a difficult decision to cancel the Corn Fest for 2021 because of the unknowns, how many people will be able to gather. I know we're only 2 weeks into the new year here, but what would your message be to municipalities that hold events, to individuals that have events planned in 2021, like weddings? Can you see like big gatherings happening in 2021?
Well, I generally am quite optimistic for most of the work that that's happening around the vaccine rollout and everything worldwide in controlling this pandemic. But despite all these advancements, the recommendations and the guidelines continues to stay. Even we have heard from the World Health Organization that despite all these vaccine rollout, there may be some challenges with people having to comply with the public health measures. We have to look at the overall rates, overall situation, that how this virus continues to spread, or if there is any if we find the majority of the people are already vaccinated and the virus is not spreading anymore in the community. So those would be some of the local indications, but we have to look at the bigger picture. We have to understand that what else is going on. I am optimistic that hopefully late summer, early fall, we may be able to get to a stage where majority of our residents will be vaccinated, and the amount of spread that we are seeing right now, we won't see at that time for sure. And then even at this point, I think we have an opportunity, instead of waiting all the way up to, when the majority of the people are vaccinated. I think that's definitely a goal, but that shouldn't give people an opportunity to do whatever they are doing right now, because vaccine is here. It will take some time, and even between now and August or early September, there will be many cases, and every time when we are talking about cases, a certain proportion of those cases will die. So we have to be careful in everything that we are doing. I am optimistic that we will get there, but we need everyone's support.
So with your optimism, if someone has an event planned in 2021, maybe the early part of 2021, maybe they should revisit it and look at, the numbers, and who knows, there could still be restrictions in place, but this might be a time, if you have an event plan, to really think what your next step would be.
I would think so, because as I said, looking at the overall plan and everything that's been put in, all the effort that's been put in by the different levels of government. I am optimistic that things will be much better in the second half of this year. But the first half of the year, I still anticipate that there will be many challenges, and people, if they're planning, I think they should take that into consideration.
Thank you.
Any questions from CTV?
Yes, good morning. Another protest against restrictions was held last night in Windsor. Is it surprising or disheartening to you that people are still disputing the measures in place?
Well, I think as I said earlier, I want to focus my energy on people who have some real questions that they are looking to get their answers. I think we and everyone else is trying our best to give them the answer to help them understand. But unfortunately, there is a segment of population, doesn't matter what answer you give them, they don't like it. So it's not about making them like the answer, it's about doing the right thing. So we'll continue to do what is right, and we'll continue to advocate for what is right for our community.
Okay, thank you.
Any further questions from CBC?
Nope.
Blackburn?
No, thank you.
Windsor Star?
No, thank you.
AMA 100?
Dr. Ahmed, just in regards to the new school outbreak at Sandwich Secondary, similar to the answer you gave us yesterday that Taylor from the Star asked?
That is correct, Rob.
Thank you.
Any further questions from CTV?
No, thank you.
Thank you, everyone.